Hi, I'm Lou Flasspuller. I'm a physician in Cincinnati, and for the last decade or so, I've been trying to be a part of helping find much healthier solutions for employers. So, the following video was recorded in June of 2020. This is exploring health sharing communities. I see the health sharing communities as a phenomenal option for small employers. With that said, this is about Caliper Energy Services, a small employer in Snyder, Texas. Thank you so much for viewing.
So as I've been on this journey, I've been just incredibly lucky and blessed to meet people that are on the leading edge of restoring health to healthcare in the employer space. So I'm going to start out with a small company based in Texas, in Western Texas, Caliper Energy Services. And what I would ask you guys in the audience to take away from this is that the health sharing communities or health sharing ministries are what I've seen as the best fit, the best option for small employers. So I was really lucky and blessed to be learning from Richard Walton and Lance Barrett, who are on today with us and will be here for question and answers. And Lance Barrett has a company that works in the oil fields in Western Texas. And from him, I learned this idea of the Permian Basin. Permian Basin is just this incredibly rich area in Western Texas, but I think quite rural Texas, that has oil and natural gases and has been fueling the nation for years. So Richard and his childhood friend back in 2014, Lance and his childhood friend, Matt Griffin, back in 2014 started Caliper Energy Services. So Caliper Energy Services does pipeline construction, road boring, porta potties, septic tanks. They're in Western Texas. And as I got to listen to Lance talk, I was just incredibly impressed with how much he feels this sense of commitment to those that are part of his work family and this desire to give that, to have healthcare benefits for them. But he talked about the idea of paying $1,200 a month, potentially just $1,200 a month from the employer side, with another huge portion coming from the employee, and how for a small business that I got the sense that Lance and Matt don't have dollars laying around all over the place that they can just give this away. So this desire to really be there to serve, but not this component with healthcare that could just drag them under. So he's struggling with, how can I do this? And the knock on the door is Richard Walton. So Richard is a broker who I stole Bob Potke's term. He eats his own dog food. So Richard years ago started using health sharing communities for his own healthcare and for the employees that work with him. So he meets Lance and they start talking, and one of the big ahas for Lance, because that Lance, I think it was trying to figure out, why is healthcare such a mess? So for Lance, part of that, the aha was the understanding that under the Affordable Health Care Act, if we're buying our healthcare from United Healthcare, and United Healthcare has $100 million in premiums, United Healthcare has to spend 80% of that, or $80 million. If they don't, the other 20% is what they can keep for their expenses, and their profits have to come out of that. So Lance, I think, very quickly put together that the only way these guys can grow is to get that pie bigger and bigger and bigger. And that for him, I think, was a big aha on part of why costs just keep going up. So he meets Richard, and they introduce the health sharing ministry. And they talk about that first year, and friends of mine have asked, how do you get people to make this move? And they talk about the first year as Richard introduced it to the employee base, as you could hear crickets, just nothing. One guy leans in along with a few others, but this guy, Yo-Yo, leans in, and I get the sense, and Lance, you can correct me later on if I'm completely off base, but I get the sense that Yo-Yo may not be in a formal leadership position, but Yo-Yo is leading a lot of people, and he's an influential guy. So Yo-Yo gets, leans in, starts using a health sharing community, and ends up needing a hernia repair. And he comes back just raving about how simple this one, how easy it was, how little it cost him, and the care that he got. And all of a sudden, many others at the family there at work say, oh my God, you can do that. So they start leaning in. Another thing that I found pretty profound that Lance had shared is that under the cost of these health, of being part of this health sharing community is so low that he's telling employees that you're stupid not to get it. Why would you not take this? It's so cheap. So one of their guys, Chris, they get him to take it. And because he's now got coverage, he gets his eyes checked. Now his eyes aren't covered under the health sharing community, but it turns out he can't see. Guy gets glasses, and now his world has just changed. And, so you're seeing all these incredible things happening. And it really, it was just very profound to me as I listened to Lance share the things that were going on in the company. One of the things I pulled from a talk that Lance gave is the way he kind of broke down, some companies may not care about their employees enough. You have to take it seriously that you're funding their families. He said, I hear some CEOs complaining about payroll, but for me, I like paying these guys. I make good money because of these guys, and I want their lives to get better. And I got to pound on people that you get a lot further lifting people up. One of the big pieces that works with these health sharing communities is direct primary care, and in the case of rural Texas, virtual primary care. So these are primary care doctors that have gotten out of the muck, are completely aligned with promoting well-being. And Lance just raved about how he can get a doc on the phone while he's at work, not lose time, and these docs care. And so there's just multiple ways that things opened up for him. On employee retainage, Lance talked about he had one employee leave, went to a union job, brought 3 other guys back because of them being able to give these health, this benefit. One of the guys that came back moved his whole family to this town. So it's just been huge for them. And Lance spent a great deal of time talking about the freedom and how it's just unshackled him with this. So in ending this, for small employees, these health sharing communities, I think, are the best option. There's alignment, and in these communities, they're asking people to be healthy. What you can expect with this is a 50% drop in the equivalent of premiums, typically a fraction of out-of-pocket costs.